I am going to treat your face for tightening and lifting using Silfirm X, which is a RF micro-needling device. I will use continuous wave (CW) mode for skin tightening and lifting procedures. For facial tightening and lifting, the treatment area can be divided into 3 parts: upper face, mid face, and lower face, and use a different needle depth according to the skin thickness of each treatment part to treat lower face. Use CW3 mode 1.0 to 1.5 mm, power 5 to 6, perform 1 to 2 passes. When treating the submandible area, the anchor is located behind the jaw angle. So pull the skin outward, anchor it behind the jaw angle, and irradiate RF into 2-3 lines along the vector. Place the handpiece on the mandible, not under the bone, and irradiate RF. Perform 1 to 2 passes, and a good endpoint is moderate erythema that gradually appears a few minutes after RF irradiation or an immediate improvement. To treat mandible area, perform 1 to 2 passes in different pulling directions for better tightening and lifting effect. A good endpoint is moderate erythema that gradually appears a few minutes after RF irradiation or an immediate improvement. For the first pass, pull the skin outward, anchor it on the preauricular area, and irradiate RF. Using the pulling technique can further enhance the therapeutic effect of skin tightening and lifting procedures. The pulling technique is similar to the technique used in thread lifting procedures, in which saggy skin is pulled upward or and outward and anchored with a thread inserted into the skin. The first pass were done by pulling the skin outward, and now the second pass will be performed by pulling the skin upward. Pull the skin upward, anchor it on the malar arch, and irradiate RF along the vector. To treat mid-face, use CW3 mode 8 to 1.2 mm, power 5 to 6, perform 1 to 2 passes. I will treat the mid-malar area first. After pulling the saggy skin upward, anchor it on the lateral side of the cheekbone, and then irradiate RF along the vector. Perform 1 to 2 passes, and a good endpoint is moderate erythema that gradually appears a few minutes after RF irradiation or an immediate improvement. When treating the lateral malar area, pull the skin outward, anchor it on the malar arch, and irradiate RF along the vector. Perform 1 to 2 passes, and a good endpoint is moderate erythema that gradually appears a few minutes after RF irradiation or an immediate improvement. To treat upper face, use CW3 mode 5 to 1.0 mm, power 4 to 6, perform 1 to 2 passes. Pull the lower eyelid outward and downward, and pull the lateral side of the eye upward. Irradiate RF in 1 to 2 lines. Perform 1 to 2 passes, and a good endpoint is moderate erythema that gradually appears a few minutes after RF irradiation or an immediate improvement. When you treat forehead, pull the skin upward. Anchor it on the frontal hair line. And irradiate RF along the vector. Perform 1 to 2 passes, and a good endpoint is moderate erythema that gradually appears a few minutes after RF irradiation or an immediate improvement. For facial tightening and lifting, I usually recommend 3 treatments at 1 month intervals. But the number of treatments may vary depending on the age of the patient or the degree of sagging of the skin.